Dr. Khaimov, I would like to talk to you about sleep apnea, which is basically the condition of stopping to breathe throughout the night many times, hundreds of times. And, of course, different people more often and different less. And by doing so, not going into deep sleep, by doing so also while one stops breathing, obviously not getting oxygen, which deprives the person of oxygen and of sleep, one of the two most important things a person can have. And by having that, the people next day, they feel sluggish, and they fall asleep. In fact, in New Jersey, a person a bus driver wrapped the bus around the pole, and he killed people, and he's suspected to have sleep apnea. Basically, you just fall asleep. There's more car accidents, deadly car accidents caused by sleep apnea than by drunk driving. So it's pretty bad. And people who need a pick-me-up in the afternoon, coffee, Red Bull, Coca-Cola, an energy bar. Not that there are not other reasons, but sometimes it's that reason. They just feel like, oh my God, and they need all that drink. When really what happened is they didn't sleep throughout the night the way they should. They don't know that even. And they didn't get the oxygen they should. Both of them deprive them of energy. Now we know that there is a golden standard of technology to fix that, which is the CPAP machine. It's an oxygen compressor, presses oxygen in it, you put a big mask on it, you have a machine there, and you put it on. So where does a dentist come in to fix it? Because obviously it is a problem which must be fixed. It's only lately that the medical field realizes that way more people have it than they ever suspected of having it, and it causes obviously all these problems we just mentioned, plus other problems. How often can you not sleep, and next thing you know is you're going to get very sick from the littlest storm, flu, or whatever it is, because your body is weak and tired. So where does a dentist come in fixing that?
Well, we as dentists, we make special device that keeps your mouth in a special way that prevents your tongue going backwards, meaning we move the jaw a little bit forward, that keeps the tongue away from closing the airway, so you get your oxygen and you get your sleep better. So you actually do not snore anymore, and you sleep in a more peaceful way.
Got it. So basically, what you're saying is that special device, is that a mouth guard or like a night guard or something like that?
It's similar to it's a special mouth guard that keeps your jaw in a way that moves the lower jaw forward to keep the tongue away from the airway. So it gives you more way to breathe.
Mm-hmm. So you are saying that I think you said correct me if I'm wrong here, that you said it also fixes the snoring. Is there a correlation with people who snore having sleep apnea, or people who have sleep apnea having snoring? Is there some correlation to that?
There is a correlation that snoring causes sleep apnea. Doesn't mean that every person who snores gets sleep apnea, but every person with sleep apnea has snoring.
Really? So obviously that's if you have a spouse, then that's a double whopper. Number one, the spouse has an energetic spouse next day who doesn't fall asleep half and is cranky because he is not so full of energy. And on top of it, he or she can sleep herself because the other guy doesn't snore, the other person. And that looks like by itself pretty good thing. So how does this dental device, this sleep apnea, compare to the CPAP machine, the compressor which presses air in it? How do those two compare?
Both of the devices, they provide oxygen to the patient, so that what keeps the patient breathe better to prevent the sleep apnea. But to go to the special place to get that machine with the mask, it's a hassle. Here it's very convenient in your own home, in your own bed. You just put the mouth guard in and have a good night's sleep.
So, I mean, obviously this machine, a person takes it home also, but it's big and bulky and difficult to wear. That's basically what you say.
It's big and bulky and noisy. So your spouse actually gets frustrated and gets her sleep apnea because of the noise that you create.
I see.
So yeah.
Yeah, well, it obviously doesn't look very comfortable to have to wear a machine with a hose going away, but probably you can't really toss and turn, where if you have a mouth guard in it, you can toss and turn and sleep whichever way you want, right?
Yes. You can turn and toss and turn and just enjoy your sleep.
And wonderful. Now, actually, is it, let's just say for people who travel, not just once a year on vacation, even though that's enough, but, some people travel more than others on an airplane and or in hotels and whatever. It's obviously way, way more difficult to carry that honky machine around,
yes.
Even if you are getting used. Because I've heard that lots of people who use the CPAP machine, they have it and they stop using it because it's too expensive. It's not expensive, but yes, it's expensive too compared. But they bought it, they have it, and it's just too inconvenient.
Yes.
But there's the other part of the people who travel. They need to bring that bulky machine, even though they make them relatively small these days, but it's still bulky. It's still cumbersome to carry around. Is it true that once you have sleep apnea, whether you wear a CPAP machine or you wear the dental appliance, once you wear it, it's like with glasses. If I am needing reading glasses and I don't have them on, I won't see. If I put them on, I see. I take them off, I don't see. Is it true that with sleep apnea, you wear one of those two appliances and next day you will be fine because you got your night's sleep, and you don't wear it next day, you will not be fine because you simply didn't get your night's sleep? Basically, it's not like food or vitamins. Well, you can miss a few days here and there. You're fine because you have something built up. This is not a built up. This is like with glasses or with lenses. You put them on, you see. You don't take them off, you don't see. Simple. Is it true that this is like that?
Yes, it is. If you use the machine, you do not provide an open airway for you to breathe, so you cannot breathe properly. So that's the reason you get sleep apnea.
So very obviously now for the traveling people, it's a lot better to have this dental device, because you put it in a bucket and that you move. It's small, super small.
It's super small. Basically it's a mouth guard that keeps you breathe better.
Well, all right. Gorgeous. Thank you very much for explaining sleep apnea and how it can be getting fixed two ways. One is an inconvenient, relatively expensive way, but very workable. And the other one is with the dentist, much cheaper, inconvenient, and also workable. And instead of having the noise of the machine, which wakes the spouse up, now you have somebody who sleeps quietly. A quiet night's sleep for everybody. No snoring. Thank you very much.
Yes, you're welcome.